When we think about health, the conversation usually starts with healthcare. And when you look at really all the factors that affect the health of the community, it's more than that. We need to think about housing, we need to think about education, employment, income, things like family and social supports and community safety. What we're really trying to do is address the social determinants of health so that we can bring together both the providers of clinical care as well as community-based organizations to address the individual at all levels. The Greater Flint Health Coalition really has two roles. First, we were created to be a neutral convener of the various sectors in the community so that we bring together both leadership and community residents to address the health of the community. We also run programs that benefit the community and the residents that we serve.
The reason that the Health Coalition is so effective is because it's a consensus-based organization that has everybody at the table making decisions about how to move forward to improve the health of the community. So if you compare what the Health Coalition's doing with other coalitions, there's no comparison. The Health Coalition is way out in front.
One of the real benefits of the Greater Flint Health Coalition is their ability to create policy and change in the community. And some of the ways that they do that is, the Greater Flint Health Coalition is an institution that is widely respected all across this community, all across the state, throughout state government, federal government, and institutions all over the place. So when they speak with authority, and they don't advocate for things unless it's in the best interest of the community, especially when it comes to health.
As the director of the MSU Division of Public Health, my impression of the Greater Flint Health Coalition is they've really been the stake in the ground for Flint and the community in the face of many challenges.
The Greater Flint Health Coalition represents everybody. They are a credible, long-standing organization in the city of Flint and Genesee County, and their number one goal is improving health outcomes for the entire city. So when I was faced with a decision of what to do next, when I knew that the children of Flint were in danger, I went to the Health Coalition first because I knew that they could bring everybody around the table to make sure that we could solve this health issue.
As a neutral facilitator and backbone, the Greater Flint Health Coalition really supports collaboration between everyone involved in the community.
The state innovation model is really designed to bridge the gap between the medical community and our community-based organizations. It's critical when a client is in a doctor's office and has health needs beyond medicine, like housing and food and transportation, that they can really quickly make the connection with the social service agencies that provide those. And this program really bridges that gap to make that connection possible.
The Flint Healthcare Employment Opportunities Group differs from other sector workforce programs primarily because we are a coordinated group comprised of local healthcare employers, large employers, along with the local schools. So we take it one step further from my perspective and really look at what the needs are of our community, not just in terms of the residents, but also what the needs are of our local healthcare employers so that we can provide the correct opportunities for training and certification, again, in an effort to keep residents locally here and provide them with sustainable wages.
The registry will give us an opportunity to really collect data on how the city of Flint is doing, how households are doing, and then the community as a whole. So that will give us a data-driven opportunity to advocate for additional resources that the city of Flint needs. What makes this project special for me is that I think this gives people an opportunity to be all in for Flint.
So Commit to Fit is Genesee County's shared strategy to encourage positive health behaviors like physical activity and nutrition. What's nice about the messaging is it's really simple, so we can apply it anywhere. Schools, businesses, community organizations, churches have all used Commit to Fit's message to promote positive health behaviors.
The Cooking with Kids program is a great program because it's teaching the caregivers and the children together. There are a lot of programs out there that are teaching just the children or just the adults, but this one is teaching everyone together as a family unit.
The Genesee County Children's Healthcare Access Program, or otherwise known as CHAP, is one of the most vital resources for kids in our community.
If there's social issues such as housing or food insecurities, those are going to be the family's main priority before they reach a doctor. So if we can address those barriers, then in turn the family is going to receive the proper care.
And it's part of the evolution of the medical home concept, where we believe if a family has a medical home where they can go for coordination and care of their services, we'll get better healthcare outcomes.
I want our children to have the best healthcare experience that they can have. We all want it. It's the purpose of CHAP. It's what we're trying to accomplish with it.
I think the Greater Flint Health Coalition is a really important part of Flint and Genesee County because it has a very narrow focus in some instances where its goal is to improve quality of health and quality of life for everyone, but it has a bigger mission that is to help connect folks and making sure that the institutions are working well together. So I think it really is very powerful when it comes to convening organizations, powerful when it comes to making partnerships, and powerful when it comes to improving the health care for everyone in our community.
The Greater Flint Health Coalition has been effective in their role as the neutral backbone and convener because they honor that role. They don't put their own organizational priorities or agenda ahead of anything. Their primary goal is to support and ensure the health of the residents in Flint and Genesee County.
Improving healthcare says it all. It's really about collaboration and working together for the greater benefit of the community. Through collaboration, we're all improving health together.